Well, good afternoon. I have 12 o'clock, so I'm going to go ahead and get started introducing today's speakers. First, I wanted to thank everyone for attending our second Georgia CTSA Maternal Health Disparities webinar. This webinar is entitled Partnering with Cooperative Extension to Engage Communities, Examples, and Opportunities in Maternal Health. My name is Sherry Boulay. I am an associate professor at the Emory University School of Medicine. Our guest speakers today are Dr. Alison Berg, Dr. Sarah Henes, and Dr. Courtney Still Brown. Dr. Berg is an associate professor, a registered dietitian nutritionist, and extension nutrition and health specialist at the University of Georgia, where she leads health education programs and interventions delivered by cooperative extension agents in Georgia in chronic disease prevention and health promotion. Dr. Berg's current research explores the impact of these extension health programs on nutrition and health behavior to prevent and manage chronic diseases, including obesity, cardiovascular disease, diabetes, and some cancers. Dr. Berg also serves on the Community Engagement Corps of the Georgia CTSA and facilitates community engaged research across Georgia through training, capacity building, and helping match researchers with communities and extension programs with common goals. Dr. Sarah Henes has been a registered dietitian for over 26 years. She is an assistant professor at UGA and serves as the UGA state coordinator for the Expanded Food and Nutrition Education Program. Her work focuses on both adult and youth community nutrition education, curricula implementation, and program evaluation and research for low-income families across the state of Georgia. Improving maternal health outcomes such as diet quality and food security and serving low-income pregnant women and their families are also priority areas for Dr. Henes's work. And Dr. Courtney Brown is a community health engagement coordinator, and she works with Georgia communities, UGA extension specialists and agents, and across the Georgia CTSA to build capacity for and implement community-engaged clinical and translational research that furthers the critical land grant mission of UGA and expands the impact of the Georgia CTSA. Before we get started with the presentation, I'm just going to run through a couple of slides. First, I want to let everyone know that CMEs are available for this webinar series. And then secondly, I wanted just to disclose that none of the planners or speakers for this activity have any relevant financial relationships to disclose. And no grant support was received for this activity. And now I'm going to turn it over to our presenters so they can get started. And the plan is that they will give their presentation and then we'll take questions at the end.
All right, well, it's great to be here with y'all today. I'm Courtney Brown, and can somebody just give me a thumbs up if you can see the right PowerPoint screen? All right, thank you. Okay, well, today we're here to talk about partnering with cooperative extension to engage communities, some examples of things that we've already done, opportunities that we're hoping to look forward to in the future, all in the area of maternal health. And I think we're going to try to take questions at the end, but we absolutely want to engage with y'all. So please save those questions up, and we'd love to have a little discussion towards the end. So today we're going to cover what UGA Extension is. So if you're already very familiar with us, you can just sort of sit back and relax for a little bit. But we know that a lot of people may not know, so we're going to share about that. We're going to talk about what Extension's role in translational science is. Then we're going to share some examples of programs that we currently do in Extension. And then finally, we're going to wrap up with some opportunities and where we'd like to go in the future. So I'm going to start off with a little bit of history. In 1914, so over 100 years ago, President Woodrow Wilson signed the Smith-Lever Act, which created the Cooperative Extension Service. And through research translation at land-grant universities, the goal was to bring the university to the people. So the idea here is that universities don't only exist to educate students or generate research, but that they should be giving back to the community through education and partnership. So cooperative extension exists through partnerships through land-grant universities across the nation in all 50 states, 5 territories, and over 3,000 counties. The cooperative extension system, in partnership with USDA's National Institute of Food and Agriculture, is operated through the land-grant university system through collaboration with federal, state, and local governments. So we basically have this awesome community academic partnership at every level, from federal to local. The full title is Cooperative Extension, but you'll usually just hear us refer to it as Extension or UGA Extension here in Georgia. In UGA Extension, we sum it up by saying we translate the science of everyday living for farmers, families, and communities to foster a healthy and prosperous Georgia. This is our mission statement, and it's what we do every day at all levels of Extension. So if you are familiar with Extension just a little bit, and maybe you thought, oh, I think it has something to do with agriculture, it has something to do with all of us, because we're all farmers, families, or communities, because we all live in a community in Georgia. So you may be wondering, what does UGA Extension do? UGA Extension spans 2 colleges at UGA, the College of Family and Consumer Sciences, and also the College of Agriculture and Environmental Sciences. And we deliver programs through 3 areas that you see here on the slide: Family and Consumer Sciences, which you're going to hear a lot about today, Agriculture and Natural Resources, and 4-H Youth Development. And although we have these 3 distinct program areas, we work really closely together, especially in the area of health, because we recognize the interconnectedness of these areas. Agriculture impacts our environment, our food supply, our food access, our economic development, and of course, growing strong youth leaders for the future involves promoting health and investing in communities, investing in those young people so that they're able to live their best life and lead us into health in the future. UGA Extension connects the resources of the university to the people of Georgia in a couple different ways. You're going to hear about several of those today. We deliver in-depth educational programs that are grounded in research. Our county extension agents that you're going to hear about in just a second teach classes that build skills and meet community identified needs. We create written extension materials. Subject matter experts at UGA develop written materials for distribution at the county level. We do workshops and events that extension staff host throughout the state. We have one-on-one interactions. Individuals may consult with extension staff at their office, at their home, or on their farm. And then also research. We do research on programs and the implementation of those programs, on products, people, and policies. And you'll also probably get to hear a little bit about some of our applied research today. So the way that we do this is through cooperation between state and local extension faculty and staff. In Georgia, we have 159 counties, and UGA Extension has a presence in all 159. So if you're wondering if there's a UGA Extension office where you live, if you live in Georgia, the answer is yes. We have 60 family and consumer science agents throughout Georgia, and I'm going to talk about what they do specifically in a minute. But overall, we are a local connection between the community and the university. Sometimes we say that UGA Extension is the front door of the university, and for some people, it may be that your local extension agent is the only university faculty person that they interact with. So we have extension agents who serve as local educators or consultants, and they're embedded in communities and they work to meet local needs. These agents are supported by state level faculty and staff like Dr. Berg and Dr. Henes, who are presenting today. They lead programs that agents deliver in their counties, and they provide support and training to them. Extension specialists are responsible for educational program development, training agents, evaluating those programs. They do applied research. They communicate with the public through newsletters, websites, videos, social media, and other publications. And as I mentioned, the agents are primarily our educators, but they also do a lot more than that, and I'm going to share some of that shortly. UGA Extension offers lots of programs across its 3 program areas, and these are just a few examples of some of our health-related programs. You see on there the logos for some of these, and Dr. Berg is going to share a little bit more about her diabetes-related programming shortly. But we do have quite a few agents trained as lifestyle coaches in the National Diabetes Prevention Program. They deliver this program virtually and in person across the state. Dr. Henes is going to share about the Expanded Food and Nutrition Education Program, or FNEP shortly, and that's just a critical nutrition education program for Georgia. UGA Extension is also an implementing agency for Georgia SNAP Ed. That stands for Supplemental Nutrition Assistance Program Education. They do this through a great program called Food Talk. Dr. Ted Futris leads a program called Elevate. That's a free relationship education program for couples in the state of Georgia. It aims to help them connect, have fun, and develop skills to strengthen their relationship. Dr. Diane Bales collaborates with some partners on Better Brains for Babies, which is a Georgia-based collaboration co-led by UGA Extension and dedicated to educating Georgians about the importance of early brain development. We also have a couple of programs that are seeking to create a culture of health through community-driven change and policy systems and environmental change. And you see those on there as Healthier Together and Well-Connected Communities. And then finally, my last little example up there, we offer a radon education program funded by the EPA and led by Dr. Pamela Turner that provides education about the dangers of radon, the importance of testing the home environment, and solutions for mitigation. So this is really just a tiny sample of what we do. We do so much more. I cannot fit it all on the slide, but those are just a few of the types of programs that we offer. So to get a little deeper into what a family and consumer science agent does, I want to share a little bit about their role as the educator and otherwise. You may hear us call them FACS agents, FACS agents. So we'll try to stick to calling them family consumer science agents, but if you hear us slip into FACS agents, that's what we mean. They deliver programs related to chronic disease prevention, healthy relationships, financial literacy, food safety, child development, healthy home environments, and much, much more. In the photos you see on this slide, you can see Mary Beth Hornbeck. She's the Rockdale County Family Consumer Sciences agent, delivering a program that she developed called Fun with Fresh Food to kids and families in Rockdale County. So while our extension agents deliver evidence-based, research-based programming in their communities, they also are responsive, very responsive to community needs. So they assess what's needed in their communities and they curate their programming to be responsive to that. Our family consumer science agents also are trusted community leaders. In addition to serving as community educators, they often collaborate on research projects with our extension specialists. In fact, they are considered public service faculty members of UGA, so they're really in a prime position to contribute to scholarly work. They also partner with community agencies on projects. They may serve on or lead community health coalitions. And in the photo on this slide, you can see Georgianne Cook and Cindy Sharam. They're the family consumer science agent and the 4-H agent in Washington County. And they are shown there with members of a community health coalition in Washington County, Georgia. So where does extension fit in the translational research spectrum? We think that extension can be a great partner in translational research, particularly in this T4 part of the spectrum, the translation to the community. Our agents are embedded in communities and they're often the face of UGA in their communities. We're building on 100 years of a trusted community academic partnership. So our research takes place in the communities. We live in that place of translation to practice and translation to community. We're very comfortable with taking what's worked in the labs and clinics and bringing it to people to test the methods of application. We do this by communicating the results of research to the community through our educational programs, but we also conduct our own research on how these programs work. We collaborate with partners to expand their research, and we communicate back to the university what works in the real world. So extension can be a great partner in translational research, particularly in that T4 part of the spectrum. Our agents, they are ready and willing to do this kind of work and really have their finger on the pulse of their communities. Excuse me. So what does translational science in UGA Extension look like? Well, UGA Extension can connect Georgia CTSA researchers with appropriate community partners. We can identify community health priorities and match community needs with research needs. We help researchers include community input in research because we already have that relationship with the community. We ensure that research efforts accurately reflect the people of Georgia and that certain groups are not left out. So we're really excited to be here today and to share with you a little bit about what extension does, how we see our future in translational research and in maternal health. And with that, I'm going to turn it over to my colleague, Dr. Berg.
Thank you so much, Courtney. That was a great introduction. Can you just give me a wave that you can hear me and see me okay? Okay, great. So yeah, as Dr. Brown mentioned, we can help researchers with community needs identification because that is part of what we do anyway, whether or not, we're doing any research. So annually, our extension agents do identify local needs. They do that a little bit more informally, but we do have a formal process for that as well. We also conduct a statewide needs assessment about every 5 years, and we recently conducted our largest statewide needs assessment in over 10 years to get a pulse on Georgia post or sort of still in progress pandemic. And see how the needs may have shifted and thus how we might need to shift our response. So our assessment was a mixed method sequential explanatory design. So we first conducted an online survey of 1,241 Georgians. And we designed that survey for the demographics or the participants to really be reflective of the demographics of Georgia. So according to the census percentages. And then we followed up with some focus groups. We recruited several groups of potential extension clientele. We had some community members and then some key partners like education, healthcare, and government partners. And the aim of these focus groups was we provided them with some infographics and some basic initial analysis of the survey. And we asked them to reflect on this data and tell us how they saw this play out or not in their communities. So, was this true of their community? Did they feel like we were missing something? Was this missing the mark? And so I just want to highlight a few of those key findings. So Dr. Brown, if you'll go to the next slide for me. So our survey had participants rank the availability and accessibility of a variety of community resources like healthy food, places to be physically active, and aging resources. And we asked about maternal health resources specifically. And what may not come as a surprise to this audience is that many of our Georgians think that maternal health services are not readily available or accessible in their communities. So on a scale of never to always accessible, about 40% of Georgians said that maternal resources are never to somewhat available in their or accessible in their community. And as I'm sure many of you will agree, we really feel like that's just unacceptable. Our focus groups then reflected on that data and really agreed with that finding. And I pulled just one quote for you here to show that, where a participant said, our closest OB is 30 to 45 miles away. Our hospital stopped years ago doing deliveries, and transportation is really a huge issue for some of these mothers. So we know that in this virtual room, many of you are here because of your interest or work currently in maternal health. We know that accessing care is a huge issue, right? That's a huge problem for prenatal health and then postpartum care, and that it's a primary contributor to both mom and baby's health. And the excruciatingly high maternal mortality rates that we see in this state. However, we know that maternal mortality or maternal and child health are also related to other social determinants of health. So I want to point out a few findings from our needs assessment that speak to that as well. So next slide, please, Dr. Brown. So like I said, we asked about a variety of topic areas, and one of the things we asked about was housing security or housing insecurity, asking about, the number of times people may have moved in the past year and the reasons for those moves. And unfortunately, we found that more than a third of Georgians noted that they were housing insecure at some time in the past year. And that's determined from a variety of factors, that move or feeling like they were going to be kicked out or not being able to make rent. And in our preliminary analysis, our housing insecurity was higher for women than it was for men. So thinking about maternal health, certainly if you are concerned about whether or not you have a place to live, that is going to impact your, health and healthcare. Next slide, please. So another area that we looked at was financial distress, which was widespread, with 1 in 3 Georgians indicating that they were financially distressed. Those who were younger, so thinking about those who are that childbearing age, especially ages 18 to 34, were significantly more financially distressed than those who were older. Also, those living in rural communities were more financially distressed, and women were more financially distressed than were men. So while I could continue to share some of these results with you, I think many of them wouldn't surprise you. And I want to move on to what we're doing here in UGA Extension to support maternal health in Georgia. Next slide, please, Dr. Brown. And so Dr. Brown already mentioned several of these, but for 2 of the things I just mentioned, housing insecurity and financial management, UGA Extension offers several programs and services like homeowner and renter education, and we participate in the Georgia Initiative for Community Housing to encourage affordable housing development and maintenance. We also offer a variety of financial management education programs, including like the virtual volunteer income tax assistance, where we help people at their local community with the support of students who are being trained in tax preparation on campus, so that they don't have to go and ask for those loans, or they don't have to go and pay for somebody else to do that tax preparation for them, so that they can hurry up and get their return. So that really helps put money back into the local community as well. And Dr. Brown, if you'll go ahead and hit so that those bullets will come up, I apologize for that. And then when it comes to more physical health, we offer a lot of support for both pre and postpartum moms, but we're looking to expand this work. So some examples are just our general educational programs around things like blood pressure, which we know is one of the primary factors that we want to be watching when mom leaves the hospital, or in prenatal care as well, or programs to support healthy weight. We know a lot of our moms are entering pregnancy and postpartum as overweight or obese, and so we have a variety of programs that can support the healthy weight, including our National Diabetes Prevention Program. And one of the things that automatically qualifies you for participation in that program is having gestational diabetes with a past pregnancy. We also have several weight management programs that are for both weight gain prevention, as well as weight maintenance and weight loss. And so those can really be tailored and appropriate for maternal health, like our Walk Away weight management program and our Better You weight management program provided through SNAP-Ed. And then lastly, we offer general nutrition education. So we know that nutrition is poor in the state of Georgia anyway, and it's really important that mom gets healthy food while she's pregnant and postpartum to feed the baby. And so we offer those general nutrition education programs. And some of them are just offered to whoever in the public. It might include cooking practice and things like that, but some of them are prioritizing lower resource audiences, including families with children and pregnant moms. And so the last thing I want to note before I turn it over to Dr. Henes to talk to you about a few of those programs is that for each of these that I mentioned here, and when Dr. Brown was speaking earlier about the programs that we have, you heard names. So each is supported by a content specialist that we call an extension specialist, and we have research and outreach expertise, and then content expertise in our particular area. So you heard that actually Dr. Brown, Dr. Henes, and myself are all registered dietitians, and so we have that expertise in nutrition, and then have doctoral training in research methods. And so, for example, I support our diabetes prevention program and our weight management program, and I do that by providing leadership, extension agent training and oversight, program oversight, evaluation, research, and content expertise. And so as departmental faculty, we conduct our own research within Extension, and then we partner with others to expand those efforts as well, and to inform implementation of our programs and improving the outcomes. So now what I'd like to do is turn it over to Dr. Sarah Henes, who is an extension specialist and registered dietitian with an interest in family weight management and maternal health. And Dr. Henes leads our expanded food and nutrition education program. And I'm excited for her to share about this with you and the exciting partnerships that she's been able to have that were inspired through some relationships within the CTSA and are really a prime example of how we can successfully partner in this state to support maternal health. So with that, I will turn it over to Dr. Henes.
Thank you, Dr. Berg. I appreciate that. Can y'all just wave that you can hear me okay? Awesome. Thank you. I'm super excited to be here. Thank you for having me. And I'm really happy to be talking with my colleagues. And so some of you may have heard of FNEP, but may not. And FNEP stands for the Expanded Food and Nutrition Education Program. And those of you who even have heard of it may not realize that it is actually this country's first nutrition education program for low-income populations. The FNEP program was started back in 1968, and it has been here through UGA FNEP since 1969. It remains at the forefront of nutrition education efforts to reduce nutrition insecurity of low-income families and youth today. I'm going to talk a little bit more about this, but in our theme here with maternal health, FNEP, one of FNEP's priority audiences is actually pregnant women and teens, and I'm going to share a little bit more about that soon. FNEP is a federally funded program that teaches healthy eating on a budget to limited resource families throughout the country. And I'm going to get a little bit more specific about what we talk about, but we do have these core priority areas in terms of our nutrition education programming, where we teach about diet quality, physical activity, food safety, food resource management, and food security. So Dr. Brown, if you could advance the slides. Thank you. FNEP is a little bit different in terms of our educator model. We do have our UGA Family and Consumer Science FACS agents, but the role is a little bit different with FNEP. FNEP across the country, it uses the paraprofessional or the peer educator model, and I'm going to expand on that in just a minute. FNEP is administered by the United States Department of Agriculture, National Institute of Food and Agriculture, USDA NIFA. That is our funding source, and through UGA FNEP. FNEP actually is delivered through land-grant universities across the country and provides state-level coordination in all 50 states, the 6 U.S. territories, and the District of Columbia. So UGA FNEP is, we deliver through Cooperative Extension here through University of Georgia. And here in Georgia, our UGA Family Consumer Science agents provide county-level coordination, and they also provide supervision to our FNEP peer educators. Our paraprofessionals or our peer educators actually deliver our community nutrition education programming. Dr. Brown, if you can advance. Thank you. Our peer educators often live in the communities that they serve, and so they are actually hired in their communities. I'm going to show you a map in just a few minutes and kind of come back to that. One of the key features or the key I guess, role of our peer educator is that they build trust and rapport with our FNEP participants. They know their communities really well. They know the culture, they know the population, they know the grocery stores. And many of you know here, say in the metro Atlanta area, grocery stores are going to be a little bit different than what might be in, say, Sumter County or some rural counties in South Georgia. Our peer educators also understand and know the food preferences of their community and the cultural expectations. Okay, Dr. Brown, you can advance. Okay, so what makes FNEP, I think, a little bit unique is that it's series-based programming for limited resource populations. We, well, there are lots of nutrition education programs that provide a lunch and learn or farmers market or kind of one-off. We are an 8-week program for our adult participants, and we provide series programming because we really are looking at promoting nutrition education and behavior change over time. As I mentioned before, a priority audience are pregnant women and teens. We also work with parents and caregivers for children, for emerging adults, that 18 to 24 population, actually, that Dr. Berg was talking about previously, throughout the state of Georgia having a bit of financial stress. We actually hone in on those who are preparing to be parents and help them in terms of financial and food resource management. We also work with youth across the state, with our focus being on teens in our high schools, 9th through 12th grade. Dr. Brown, you can advance. So over here, I've got a map. And FNEP is not in every single county, but if you notice the dark blue and where we have stars, that's actually where our peer educators and some of our our supervisors, the FACTS county agents, sit as well. And the light blue is where we have a reach. So for example, if you notice towards the south of the state in Lawrence County, we do have 2 peer educators and one of our FACTS agents who supervise those educators, but they can expand into the surrounding counties like Telfair. And so, you know, we have about a 48 county reach across the state. We provide direct education that are delivered by our peer educators in a series-based curricula. Our adult curriculum is called Food Talk. It's 8 lessons over 8 weeks or twice a week over 4 weeks. A key feature is that our peer educators actually do food demonstrations and recipe sampling with each of our lessons. We don't provide financial assistance. That is something that is different. You know, like SNAP-Ed and SNAP provide supplemental nutrition education and assistance, financial assistance. Whereas FNEP, we actually provide what's called educational extenders. And so they may be, say, measuring spoons or cutting boards or something that helps participants apply what they learn with each session. If you could advance. Thank you. We also evaluate our program outcomes. We have NIFA actually mandates that with our adults, we collect demographic information, self-reported health behaviors through a 30-question questionnaire, both pre and post programming. We also collect a 24-hour food recall. All of this data comes to our state office here in Athens, and we analyze that data through Webinars, which is a national database for FNEP. And every year we do a yearly report, not only to NIFA, but through our cooperative extension leadership. And we provide our impact statements in terms of how our programming is impacting our adults and our youth throughout Georgia. If you can advance. Thank you. So here I want to talk a little bit about our partnerships, our FNEP partnerships. And as Dr. Berg alluded to earlier, in terms of partnerships with the Georgia CTSA, actually back in 2020, if we remember, that was when we were in the pandemic, actually Morehouse and the PI, Dr. Latrice Rollins, reached out to UGA Extension and FNEP through her Project Dine, which is Dads in Nutrition Education, and asked, hey, would you guys like to partner with us and be the nutrition intervention in our study? And we said, oh my gosh, this sounds great, particularly because their priority research participants were pregnant moms and their partners. And so we actually were the nutrition intervention in 3 of their intervention sites. They also had a control. And one of the things through this partnership over the couple years has been we delivered our adult curriculum, Food Talk, which is good. It's a very good curriculum. It's evidence-based. It is based in terms of the USDA dietary guidelines and My Plate and those principles, but we did not have a pregnancy-focused curriculum. So the partnership has also led through us getting some pilot funding to expand and actually implement a pregnancy-focused curriculum in a couple of pilot areas across the state, and to look at outcomes and implementing in that space. The other partnership now with Morehouse is community-based participatory research, kind of what we've been talking about, and Dr. Berg and Dr. Brown have been talking about what Extension does in terms of asking the participants, asking the agencies in the community what works for them. And not just kind of going in and saying, here, this is what we're doing. If we say, here, this is what we're doing, we ask for feedback. Is this working for you? So in terms of FNEP, and we're piloting what's called Baby and Me. It's a session 8 series. It's based off of our Food Talk program, but it's specifically for pregnant women and their families. And we have some partnerships at the Kroc Center. One of our pilot programs is in Richmond County, another's with the Alpha Pregnancy Center, which is in Albany. And we also have a pilot going on in Sumter. And so this is just an example of how, in terms of how FNEP and UGA Extension, and we can be partnering for research. I think that's all I have for right now. So I'll turn it back over to you, Dr. Berg.
Great. Thank you so much, Dr. Henes. Yeah, I'm excited that Dr. Henes could be here to kind of talk about how her relationship with some colleagues started by reaching out to identify a nutrition education curriculum that could be used for this particular priority audience. And I want to wrap up by sharing some lessons that we've learned from Dr. Henes's work and our experience with these successful partnerships. We're definitely looking to expand our work in maternal health. We know that this is such an important area. We have terrible statistics in Georgia, and we want to support improving these health outcomes for mothers and babies. And like Dr. Henes said, where she had Food Talk that was not specifically aimed at pregnant moms, and then now is working on developing material specifically for that audience. We would like to do that in our other general programs as well, where we may not be looking at low resource moms in particular, but just moms in general. But Dr. Henes's work is such a great example of how we're well positioned to collaborate with other content specialists and healthcare providers and others to support maternal health. And we're really looking to create those strategic and appropriate research partnerships that respect our roles in communities and your role in your organization. So Dr. Brown, if you'd go ahead and click for me on some of those bullets. As Dr. Brown mentioned, at the beginning, that we have over 100 years of experience cultivating these local relationships in Georgia. And as such, we are careful to respect those relationships. So we're looking to collaborate with researchers and practitioners and other partners who are willing to work with us and respect the boundaries of our work and our funding sources and those relationships that we have in the community. We take those very seriously, and we're proud of the connection that we have. And so we want to make sure that when we partner with people, it's for the right reasons and in the right context. But we are excited to partner, and we are looking for those partners. And Dr. Henes's example of the FNEP collaboration with Project Dine is a great example of how the researchers, found ways to leverage the complementary strengths towards improving health in Georgia while respecting the confines of this federally funded extension program that has a primary responsibility to educate and to serve. I would imagine some of you on here are researchers and some of you are clinicians and providers. And so we all have our different aims and what we're looking to accomplish. And so we like to be upfront at the beginning about, how we can be a good partner for you. Just another example for your reference that I have about partnering at the right time is during COVID, I started to work on a proposal with some colleagues to explore a mobile app to monitor and report blood pressure and other postpartum complications with new moms, which obviously is a great program, and it was a great concept and something we definitely want to support. And we think that Extension could be engaged with. But we ultimately determined it wasn't a good time for Extension to support that because of the lack of infrastructure to then contact local or far away healthcare providers to provide support during emergencies, and we didn't want to put extension agents in a position that was outside of their scope, trying to help these moms when they didn't know where to go. So I don't mean to say that in a negative light, but just to say that sometimes we get together and we start to explore a partnership and it sounds really good, and we might find that it's not the best time for that. But in that case, like, we're still talking to that group of researchers and trying to figure out when is the right time for extension to come in. And I think, and we're really excited about that coming down the pike. So we are trying to develop several resources to help you partner with us, researchers, clinicians, and Dr. Belay shared a few of those in the chat earlier today. So you can pull those down as PDF, and maybe Dr. Belay, for those who joined a little bit later, we can pop them in again. But these just kind of share a little bit about what an extension family and consumer science agent does, and the way that extension is involved with researchers. So you can have that at your discretion to kind of think about later. The other thing we have through the Georgia CTSA Community Engagement Corps is the ability to actually request support from the Community Engagement Corps. So maybe you're looking for that community feedback on your research project, or looking for those specific partners to support your research project, and you don't know if extension is really the right fit for that. Maybe you just know that you need community partners. And so you can go to the Georgia CTSA website here under our community section, and there's a button to submit a request. And there are several levels of support that you can submit requests for. You can come to our one of our board meetings and just pitch your idea and get some basic feedback. We can set up a committee to work with you side by side as you prepare your grant application and get ready to launch your project. And if you're a researcher and you have you're applying for a grant that requires a community steering board, the Community Engagement CTSA Steering Board can serve as your steering board as well. So that is a good way to kind of get first connected with our Community Engagement Corps at large, which involves others that are on this call as well. And then lastly, we're looking to establish more collaborations between extension, healthcare, and community health workers. And I put that's in progress because that's something that we're trying to figure out, how do we partner? What are the right roles? How do we get connected? We have some great relationships with healthcare providers in various counties where physicians actually refer folks to our diabetes prevention and our diabetes self-management programs. And we feel like we could have more of those types of partnerships with local healthcare providers. Also, as part of our Community Engagement Corps work, we are strategically trying to figure out how extension and community health workers in Georgia can work together more actively and efficiently. I saw that I think Adrian Proler, one of our colleagues, is on today representing community health workers, and we feel like we have some real complementary strengths. And so when I think about projects and ways to expand the reach of maternal care in Georgia, we might be able to all be a part of these strategic partnerships and consider the various roles that each of us can play. So again, you can reach out to us through the Georgia Community Engagement Corps website through a support request. And again, that would reach you to the Georgia CTSA Community Engagement Corps a little bit more broadly. Or if you want, you can also reach out to Dr. Courtney Brown as our community and health engagement coordinator, specific more to cooperative extension, but really to all CTSA, but to cooperative extension especially. Or my credentials and my email address and contact information are on there, as well as Dr. Henes. You have specific questions about FNEP, Sarah would be a great resource. If you have specific questions about our diabetes prevention program or self-management or weight management programs, you can absolutely reach out to me. But just want to give you a variety of ways to get connected with us, because those initial conversations of kind of who are you and what do you do and what do we do are sometimes the best place to start at before you even have maybe a project or initiative in mind. And so with that, I just want to say thank you and for having us here today. And I hope that this has given you a little bit of a better understanding of what extension is and does and some of our specific programs and ways to partner with us. And at this time, we can open it up for questions if you guys would like. So if you want to put questions in the chat, you can do that, or you can raise your hand or come off speaker. And I think I see Adrian Proler. Do you have a question?
Yes, hi.
Hi.
Can you hear me?
Yes, we can hear you, Adrian. How are you?
I'm fine, thank you. Thank you for doing this, for doing this webinar. So yesterday I was in a meeting with some community health workers who are trying to address food insecurity issues by getting community health workers together to develop a community garden. We've kind of got a pilot project funded by the National Association of Community Health Workers and headed by Danina Battle, who couldn't make today's meeting. But so one of the things that we were looking at was to, so it's a model that tries to get, show community health workers to develop community gardens to address food insecurity in the metro Atlanta area. And so we were trying to see about getting training through the extension office through the Master Gardener program, which that's run by you, right? That's run by the extension office. And in Fulton County, so we kind of hit a roadblock because we looked up on Fulton County, and to sign up for that program, it's a Thursdays. It's an 8-week program, all day, pretty much all day. And I think it's 9 to 3 on Thursdays. And none of the community health workers could commit to taking the time off on, every Thursday for 8 weeks to take the training to be a master gardener. So that's, I guess that's, you asked how you can be better partners.
Yeah.
So that would, if you could have programming that would be able to accommodate the schedules of people who generally have jobs, that would be, or I don't want to say generally have jobs, but have.
No, that's a good point, Adrian. I think I can address that a little bit. So, and that's a really good way about thinking about how to contact us, or kind of how you engage with us. And so really, that program is quite specific, the community or I'm sorry, the Master Gardener program, and it is very involved. I completely understand. But that's a perfect example of like how you would get in touch with us for your needs, and then we can help you figure it out. So in that case, I would encourage you to go to our website and find our county offices. So in this case, it would be your Fulton County. So Courtney, would you mind popping in there the address for the extension.uga.edu and where the county offices are? So you could call the Fulton County office, and this is why we say like extension is like the front door of the university. You could just call up that county office, get a hold of either the Family and Consumer Sciences extension agent or really the agricultural agent in that case, and just say, here is what we're looking to do. How can we partner? Like this Master Gardener sounds good, but it's maybe not a fit for, not a fit for exactly what we were looking for. We're really focusing on community gardening. And then that extension agent can figure out what is the next best step. Is that working with you to provide a few smaller, one-off programs at night, on the weekends? Because extension agents offer stuff at all different times, and they really try to meet communities or community members and groups where they are. So like Dr. Henes's program, I know she'll talk about, the fact that agents go out to these different agencies where we're going to provide the program and talk to them about what's the best time for your clientele. I mean, clearly folks who may be working during the day can't come during the day. So that would be a place where I'd say, go to that county extension office, and then they can help you navigate that. Sometimes that involves, calling up one of us as specialists and saying, hey, I have a lot of interest here for a particular type of programming, and we don't have something that fits. What can we do? And that is the role of the specialist, to work with the agents on that. So Adrian, because you and I know each other, I'm going to say we should follow up on that. But I think for anybody else who's listening, the take home message there is to call your local county extension office, or if it's a particular program that's listed on the website that has a program coordinator or a specialist identified, you can contact us and we can help you navigate that. The other thing I wanted to just share with you is something new that we just put up, because community gardening is definitely something that has become of greater interest. And I'm going to pop that site in the chat for you there. We just put it together a little community gardening toolkit, because that is something that we've been working on a lot in our rural communities to address food insecurity and food access. And there's a lot of really good resources there on, starting the garden, having a contract, some harvest recommendations, and then it also links you to our agricultural extension publications that are more technical about gardening. So that's one of the things that we do too, is provide these extension publications that are good resources for people to follow up on these topics. So I hope that, Adrian, that kind of helps. And I hope that for the other folks on this call, know that, that's where you start. You go to your extension agent and you make your request, and then they call up me and say, hey, Allie, I need a program on X, Y, or Z. Or they say, okay, community member, I know I can point you in this direction, or I can give you this and this, which are related. So, that's really where we thrive, is helping you connect with the right resources for your needs.
Thank you so much. That's like Sabrina's involved in that, and so is Tracy Carter, who's on this call as well. So we will follow up with you. Thank you so much.
Great, thank you. Are there any other questions that we might be able to answer?
I had a question for Dr. Henes. I was wondering how the FNEP program kind of connects pregnant people with the peer educators. Do providers refer their patients there, or is it like self-referral? How does that happen?
That's a really great question. There's a lot of different ways that it can happen. So for example, with one of our partnerships, say in Richmond County, our fax agent actually, our FNEP, and she's our FNEP agent, but a fax agent as well. She actually has had partnerships in the area with pregnancy centers, or with WIC, or with some of those leaders. And she is a liaison in terms of working with linking up with FNEP and introducing our peer educator, and seeing if our programming is a good fit as well. And so, it could also happen where a physician says, we do have WIC, but we would love something that is more of a series based, or can kind of reinforce some of what our patient needs, what's available. And that's, they can also refer to FNEP as well. So it could go all these ways. And just like Dr. Berg was talking about, FNEP is definitely excited in the opportunity to partner more with clinics and with physicians, if it makes sense for their patients.
Yeah, I wondered if you'd heard of Grady's Food as Medicine program.
Yes.
Okay. Yeah. So you're
Yes.
aware of that. I think that would be an area that would be great for partnership.
That's a wonderful idea. And we are in the midst of hiring peer educators in the Fulton County area. We do have peer educators in DeKalb as well. And so would love to continue conversation and see where that might happen. So thank you.
Yeah, thank you. To answer Adrian's question, we've recorded this, we will post it on the CTSA website, and we'll share the link with everyone who's registered for this presentation. So yes, you could share it with whoever you want. We'll try to get it up as soon as possible.
Thanks.
Sure. Any last questions or comments?
So I don't want to put Dr. Franklin on the spot, but I do. And would like to find out, with all of the work in maternal health that you're doing, does any of this resonate with you? Are you seeing any ways that there can be some partnerships? Any thoughts on what you've heard.
Yes, and I hate you put me on the spot too. But great talk. I've already sent an email to some of my colleagues about how I think we need to incorporate some of the work of the Georgia Extension Center with some of the projects that we're doing. And in fact, one of my colleagues on a project that started as the Southeastern Maternal Health Community Implementation Project and is now called Project Impact, is looking at preconception care for women and men in 4 states, including Georgia, North Carolina, South Carolina, and Tennessee. And Dr. Latrice Rollins is one of the co-PIs on that project. And so not only did I give her kudos for being mentioned in your talk, it gave me an idea that we really should be leveraging the resources of the extension centers in all of those states to help to achieve our goals of implementing preconception care counseling through community settings in those states. And so there may be more to come.
Great, thanks for letting me do that. And of course, Dr. Hernandez as well with the Impact Project. Yes.
Yeah, yes, Dr. Hernandez is the contact PI for that project. And I emailed her as well.
Thank you so much.
Thank you for bringing that up, Gail, to our friend Gail McCrae and also fellow Community Engagement Corps representative. And Dr. Franklin, you may not know me, but I recognize you as a celebrity in this area. And so last time I saw Dr. Hernandez at the External Advisory Committee meeting. Ever since then, Dr. Brown and I have been trying to get a meeting on the calendar, but you know, she's a busy woman. So we're really looking forward to those potential opportunities with you.
Well, more to come, and I applaud you all for what you do, and this has opened my eyes more into what happens with the extension centers, and so I'm grateful for it.
So Allie, I think we have a hand up. There's one hand up, Mamhar Gay.
Yeah.
Yes, hi. My name is Mamhar, and I'm a MPH student at Emory, and thank you all for being here and for sharing such insightful information. My question is regarding whether there's any ways in which the Extension Center's programs target specific minority communities, because we know that disparities are different across minority groups. So for example, with African American women, the rates of maternal mortality are even higher. So I just wanted to know in what ways are programs specifically targeted to improve maternal and child health within those minority communities?
So I will do my best to answer broadly, and then I'll ask Dr. Henes if she has additional information. But one thing I mentioned was that our extension agents are required to do regular county assessments. And one of the things that they are tasked with is making sure that their programming is reflective of their community demographics. And so like they can't, if I break it down to very simple terms, if the community was 60% African American, Black or African American, and their programming was reaching 100%, you know, white or Caucasian adults, then they would be considered not meeting those community needs. And so they are required to work within the community to make sure that they are reaching the audiences and their programming is reflective of those audiences. I think the peer educator model is a great way to show that we're being strategic in that, because the peer educator model that FNEP and SNAP-Ed use is trying to bring in people from the community that might have more of an in with particular demographic or otherwise groups. We also, through our extension agents, they have like local program leadership teams and community councils where they might connect them with, you know, the local Hispanic Coalition or others in the community that might be able to connect with specific groups. And then our extension agents, you know, provide feedback to us about how, you know, when they go to deliver these programs, I mean, that real implementation expertise is like, hey, I'm teaching this program and you created this, and it's really not resonating with the folks in my community because there's no pictures of, you know, the types of foods that this group particularly likes to eat. Or, you know, you were talking about something using this terminology and it doesn't resonate with my community. And so that's some of the more informal ways too that information gets, you know, channeled back up to us. There are some other examples in the ag space and what have you. But Dr. Henes, is there anything you'd like to add to round out my response?
Yeah, thank you, Dr. Berg. That was a great response too. And I appreciate what you're saying. And that is exactly true with the peer educator model. We have a really diverse workforce in terms of that peer educator model. For example, we have, as Dr. Berg was saying, peer educators that represent the communities that they serve. And, you know, to speak to some kind of the demographics. So FNET by its nature is specifically to reach those limited resource audiences across the state of Georgia. And we collect demographic information in our entrance and exit packets. And over the past several years, what we see is that out of the state of Georgia in our adult population, say we enroll 2,800 participants through FNEP across the state in a year, 55 to 57% of that population tends to identify as African American or Black. At least 14 to 15% of that population tends to identify as Hispanic. And so, you know, we have data to support that we're reaching those populations that may have those disparities, as you mentioned. And then the peer educators, so say, for example, we have FNEP in Gwinnett County, and our peer educator, she is bilingual and Hispanic and Spanish speaking. And we actually have our food talk curriculum in Spanish as well. And so we really work to meet those needs, that cultural need as well across the state. And we realize while we have a standardized curriculum, that's the cool thing with our peer educators, is that they teach to their people, you know, and they have a different spin. Say in Lawrence County, it's going to be a little bit different than it is in Gwinnett, and it's going to be in DeKalb. So I hope that answers some of your question as well.
It does. Thank you so much.
Okay, I think we are at time, a little bit over, but we've had some really great conversations, and I wanted to thank again our presenters and let everyone know that we will be sending out the link to this recording and the materials. So if you weren't able to get them in the chat, just check your email. And thank you so much for attending. Have a great afternoon.
Thank you for having us, Dr. Boulay and colleagues.
All right, bye-bye.
Bye.
Thank you.